Now, spaying and neutering cats
Yeah.
or dogs, animals. I know
Yeah.
you wanted to address that also.
Yeah.
I mean, we all know we're supposed to do it. We all know that it's something that we should be doing. But I know that's something that you wanted to talk about. So.
Because I find most people don't even know why they're spaying or neutering their pet, and it's probably a good thing to know so you can make a choice. There's extremes, and humane shelters always are very cautious and very, I don't want to say pushy, that's the wrong term, but they are very strong advocates for spay neuter simply because their business is being the end. They're the last one down the chain who end up with these pets that no one wants. And it's very hard for them to watch a pet go out the door that hasn't been spayed or neutered, knowing that that's potential X number of more kittens and puppies that could come back to them that they have to find homes for. And certainly we're lucky. We have great humane shelters in our local area. They do a very good job, but if you look at places further south in the southern end of our country, most of the shelters are what they call high kill because there is such an abundance of animals that are unscrupulously bred or just allowed to roam free, and they do what nature calls for, and there's lots of unwanted litters. So the reason predominantly behind spay neuter is that we don't have unwanted litters. So when a client says, I'm a good pet owner, I keep my dog leashed or in my home, I'm not going to let them breed without me, making this a plan, is that okay? The answer is, I think, sure. But that being said, the flip side of why we also spay and neuter, it's a much easier animal to live with. Marking territory is an innate behavior in dogs and cats. And when hormones are present, testosterone for males and the estrogens for the females, marking their territory is a little bit more important to them. Without those hormones, they're less likely to want to mark around your house to say, this is my house, other pets stay away. Dogs go into heat twice a year, and that's not a fun thing to live with because it does last about, on average, 3 weeks. So just for ease of living with them, a spay or neuter pet's an easier creature to have around. Then you get into health issues. Spaying and neutering too late can create some problems, too early can create some problems. A quote from one of the veterinarians who's done some studies on this from UC Davis said that if we spay or neuter at a young age, we do many things good for the animal, and we do some bad things. And same for if we wait till later. So, for instance, if we spay a female dog prior to her first heat, the chance of her ever developing a malignant breast tumor in her future is practically nil. And that's a big deal because dogs who have breast cancer, they run the same rates, intact females run the same rates as human females, and our success rate for treating and curing them is much, much lower with pets than it is for humans. But if we spay or neuter extremely early, which is what many shelters are doing, and again, for the reason that they don't want to let a pet go and risk that somebody doesn't bring it back to have it spayed or neutered later, we are seeing some issues with increased joint problems as they age. Their bony development might not be optimal. So you have to talk to your own veterinarian to get an idea of what is ideal for your pet. Sometimes older male dogs have to be neutered when you weren't planning on it because benign prostatic hypertrophy is a problem in dogs as well as humans. And
Really?
the neuter, it removes that problem. It lets the prostate go back to normal size. Not really an option that humans go for. But for the dog, it's really not a bad thing.
Okay. And if you had an age of, I know you talked about the earlier and
Right.
with the female, but if there was an age that you would have to look at a cat and a dog, what would be
One
kind
of the
a-
old
an-
standards,
more of an appropriate
right?
time?
For veterinarians, one of the old standards was around 6 months of age is an ideal time to spay or neuter because most females, cats or dogs, won't go into heat before 6 months. It's more like 8 months and older, sometimes as late as a year and a half. And if we can avoid that first heat for multitude of reasons, that's helpful. The male dogs, you can wait till later. I have many owners that will wait until age 1 simply because, again, better joint development. We might be improving their longevity as far as how their hips are formed and their knees are holding up. But often they'll show up at my door at age 10 or 11 months and saying, he is now lifting his leg all around my house. And that's when the hormones are kicking in and he's marking his turf. And so they opt not to wait till the 12 months. And it's not that 12 months is a known entity of a magical number. It's just if we can wait a little later, great. But for the females, I also wonder about whether it's really worth letting them go through a heat cycle. Going through a heat does not make them a calmer dog, does not make them an easier to train dog, which is a wives' tale. They mature just like our children do at different ages. And it's maturation that settles them down, if they're ever going to settle down, not the heat cycle.
Okay. Now, Orleans County is a little bit of a financially strapped county. A little bit. As other organizations that actually, if someone does really want to
Yeah,
do what's
and
right,
that's-
is there a place that they can take them to
It's
actually
so
that will get some
good.
financial assistance?
Yeah, I can talk about the two organizations that I'm working with, and I think most of our Orleans County veterinarians are associated with this. One is a state-run program called VSNP, and that is...
VSNP, really?
VSNP. Sounds like a... Yeah, it's not that. It's... and again, I'm bad at acronyms, but it's basically, it's a spay-neuter incentive program. That's the SNP part, and the V must be for Vermont. And it is based on financial need. They have a form that can be found online, and any veterinarian that's participating in the program can have that. We can print it for you or send it to you as an email. And you just have to fill out some things based on your last income tax return and information about the owner, the pet that you own. And it's a great program in that they will pay for the spay or neuter, first rabies shot, first distemper shot, all for a $27 copay, which is phenomenal. And again, it is based on financial needs, so some people might get turned down from it. There's another local group that is run by Dr. Alice Susi, one of our favorite old chiropractors in the
Alice, yes.
area.
Mhm.
Yeah. And they will supplement what your bill might be based, again, on a criteria that I would let her describe to you. And because we're on TV, I'm having a brain cramp of the Northeast Kingdom Spay-Neuter Clinic, I believe is what it's called.
Well, we can always go back and
Go
talk
back
and
and check
always
with
put,
that,
put,
yeah.
put everything
But those
in,
are
so.
two local organizations. And again, your veterinarian would probably have the contact information if you need any of that. But it's nice because, as with human medicine, veterinary medicine is accelerating prices because some of the standards of care have changed. Things that we used to do in small general practices are almost... without a specialist there, it's almost becoming malpractice to do these things. Unfortunately, in the litigious society, veterinarians are up against some of that too. So we have prices that have to reflect what we're capable of doing, what we have to buy. A lot of our products that we're purchasing for your pets, surgical equipment has really gone crazy in the past 20 years. And that does, reflect in what we have to charge our pet parents. So to have these programs for something that's pretty much a fundamental of owning pets, which is basic vaccinations and spay and neuter, it's great to have that.
And like I said, we can have Todd maybe put that up at the end.
Yeah.
Their the name of the organization and the telephone
Absolutely.
number. So,
Mhm.
okay. Now this next one obviously is a little bit hit closer to home for me. I think when we talked a little bit the other day, I told you that I have a rescue dog here who was unfortunately pretty well beaten and abused as down in Kentucky, tied to a tree and shot at, and just had a horrible life. So I know we want to talk about emotional health of dogs and cats, but with Kira, it's again, I'm not married. She's my baby. She's my child. I don't have children. So I want to do what's absolutely best for her in terms of giving her the emotional support, and I want to spoil the out of her, and I want to give her everything she possibly can get and what I can do for her. But where do I draw that line? Where is that line drawn where I'm actually not helping her anymore? I'm actually hurting her because I want to give her so much love and so much attention and everything that she was not getting her first five years.
We have a
life.
common saying in veterinary medicine about killing them with kindness, and we do. They're just, obviously, I'm an animal lover, and they're just adorable little things that you just want to make their life perfect. But just like with your children, it's best that you have a set of rules that have to be adhered to. And if your children didn't have, as they matured and had school structure to step into, be it homeschooling or going to school, if the child was just left at home to sort of do what they wanted all day long while you were at work without guidelines and an expectation of what they should be doing, you end up with not an ideal child. And it's not a developmentally advanced creature. And we can do better with our animals for the same reason. If we adopt a pet and then sit it at home in the kennel all day while we're at work, which I'm not saying that's bad. Dogs spend most of their day sleeping. And so while you're at work those 8 or 9 hours, that's perfect sleep time for them. But it's what we do when we are back home with them. Interaction is important. And I know growing up with parents who weren't really animal people, when we would get a dog, it would be either a good dog or a bad dog. And I don't feel that they ever understood that animals do have emotional health. And some animals are a little bit more ornery to deal with and headstrong, just like many people and youngsters we know, and others are much more complacent or even manipulative to get what they want. I see it in dogs and cats all the time. So to stimulate them when you're there is important, and certainly exercise is the big thing. A tired pet is a happier pet. It's easier to train, so especially with our younger crew, if you can sort of exhaust them with some great exercise, which really benefits us too, to get out, force yourself to get out during those winter days, throw the ball for the dog, take some walks. With cats, there's lots of fun. You can even be the couch potato and sit on your couch with a laser pointer, and your cat can get a heck of a lot of exercise as you make it chase the laser pointer around the house. So first part of emotional health is actual good physical health. Then spoil them with anything you want, but they have to earn things. Happy dogs have a job. And so if the dog loves the treats that you give or whatever, or just even the petting and loving, they're not allowed to sort of come up and tell you it's time for you to give me the treat. They have to perform something for you. So just a sit and a stay is a very simple command. When a dog comes up and keeps throwing its nose under your hand, so forcing you to pet it, we take that as, oh, they love me. They
Absolutely.
do, but they're also saying, I'm in charge. You will pet me when I tell you to
Really?
pet me. And if we continue to allow them to run the show, they're very strong in their innate nature of an alpha and a dominance figure in the household versus the subordinates. And a lot of dogs are alpha, and they're going to try and make us their subordinate. And that's actually not a healthy balance. And to over-sympathize when your pet is hurting, your kid's playing baseball gets hit by a ball, and you know it wasn't anything really dangerous. But if you run out to the field and make a big scene of, oh, you're hurt, the child's going to probably melt into a pool of tears because they're scared because now you're scared. Same thing for your dog or cat. I find that when I give vaccines to a pet and the owner is almost in tears, that's the animal that usually yelps and doesn't like the vaccine. They're very intuitive with us. They read us. And if we can act, you don't need to put on a brave face, just really think about what a vaccine is. It's a very small needle, very quickly inserted, and very few animals really feel that for the most part. But when the owner's sitting there letting the dog know this is the most horrible experience you'll ever have, that's the
Projection.
outcome.
They're projecting
They're
everything
projecting.
else, their fears
So the
onto
next
dog,
time
yeah.
the pet goes through similar, be it at a vet office or, if you did it at a dog park and you were, making them fear some of the other animals there, they're going to be a fearful pet. So animals do have an emotional health quotient that we really should work hard to live up to, giving them a level, they should have a standard that you expect that animal to meet. And giving them that job to raise up to that standard, that's their job, is just to live up to, I will never jump on the table at dinner time and eat. I will sit when I am expected to get the treat I've been offered. That's great.
You know how hard that's going to be for me.
Yeah, yeah.
It's going to be so
But
hard to
we tease
change
about
that.
the emotional support animals are for us, and then how sometimes animals end up having emotional support people.
Well, that's me.
Yeah.
So when she comes up to me again, kind of using my example,
Right.
and she kind of nudges the arm,
Yeah.
and wants to get wants me to pet her.
Yeah.
I should make her work for that. A
The
little bit
correct
more.
response would be, certainly you don't fling them away or anything like that. There's common sense to it, but you should be the initiator. So when she's showing you she was wanting some affection, which nothing wrong with everybody wanting a little affection, but sort of, maybe straighten up, call her to you, make her sit, then give her all the loving you want, because that's great. They love it, you love it. It's great for all of us, those endorphin releases and everything.
Absolutely.
And spoiling them with food is another thing. We do see people killing their pets with kindness. And if you really can't resist those big brown eyes when they're asking for a little Temptations treat or a Whiskas or all the little things that my cats will drive me nuts for, go for the smallest portion size and the lower calorie thing. A dog has no clue that you either handed them a giant bone or the tiniest little piece of meat or a cat treat. If you gave something tiny 8 times or one biscuit one time, they're going to look at the number, not the quantity.
Mhm.
And so that instead of giving, and what they'll do is if you give them one giant treat, they'll be back at you asking for more. Next thing you know, you've got a rather, what we refer to as coffee table dogs that have a flat back. Not great. So some of the cat treats and dog treats out there will advertise how many calories are in there, and go for those lower calorie ones and
Give them more.
give them more of that. And that doesn't mean to equate, if it's a 2-calorie cat treat, we don't need to give them the whole jar in one day.
Mm-hmm.
But again, it should be initiated by you, and dogs and cats that are food motivated, that's a great way to train them to the things that you expect them to come up to in life. And if they're not food motivated, you have to find things that are their currency. And sometimes it's a toy. Sometimes it's the reward could be just a quick walk around the house.
Mhm.
Again, they're not big into understanding time, it's frequency. How many times do we get to go out and walk? There's your key to how not to overfeed with treats, or supplant things that are also fun as a treat. Doesn't have to be food.
All right, a little off topic here,
Mm-hmm.
and talk about emotional health. What about dogs or cats who want to sleep with you? I know you're not a behaviorist. I know
yeah,
this probably
and
isn't
that's like
quite
people. Do I
your
sleep with my
alley.
baby or not? I think it's again. I'm very centrist, middle of the road. I think people want to sleep with their pets. Great. Obviously, I would love to see that you have a rather clean, parasite-free pet. There are dangers with some of the things that dogs and cats can bring us if, again, keep up with parasite control, because some of these things are catchy to us. And obviously grooming. You don't want a dog that just was out running through the puddles, hopping into your bed, and just for sanitary conditions. And what I find is that most of the time pets will take over the bed. I hear that all the time, and we let them. And I think part of we're at our most vulnerable when we're trying to sleep, and it's easier just to make room for Fido and let him be happy. And they're thrilled by it. I don't see it as being a problem, and it's everybody's individual,
I have a California King. You know how big
Yeah,
they
it's
are.
huge.
So the dog Kira gets this
About
much of the bed.
3/4 of
I
it.
get this much of the
I would
bed.
believe that.
And it's a California King. And I'm like snuggled over into this tiny little
Yeah.
corner, allowing Kira to kind of dominate the bed. So
I'm shocked at how much a cat can take up on your ability to not move freely, because a cat has that innate sense to be able to look at you with such disdain that you disturbed me, and you feel bad. But yeah, again, I can't. I've never encouraged my pets to sleep with me, but I very rarely wake up without some cat laying on my legs.
one of the 8.
One of the 8 at least finds their way up there. And so again, I don't see the dangers for it, with the exception of people have repeatedly tell me little dogs love to burrow down under the covers and sleep down near the bottom. And we have actually heard of a couple of times where the animal's been entrapped in some of the sheets.
Good.
And if they go into panic mode, then all of a sudden the oxygen may not be sufficient, and they start having some distress. So I have heard of cases like that. That's about the only danger.
Right. That actually brings us into the next question about what's an emergency and what's not an emergency.
Right. And it's being a layperson, it's hard to know. And again, you might want to, when you have your next vet visit, say, here's things I encounter that I'm never sure of. What is good, what is bad? Am I being overreactive or not? Certainly, I define, and this is just for me in my practice, because I do see emergencies for my clients, so I like them to know so that I'm not getting awakened, because, again, I'm older, I love my sleep. I don't get awakened at 2 a.m. for something that really is not life-threatening. And again, I do define an emergency as something that is life-threatening, or the comfort of the animal is so severely diminished that it should not wait until the next business day or a weekend. And again, a weekend would be a little different scenario than an overnight. Now, for instance, an animal that falls and breaks a leg is in pain. Yes, it is not usually life-threatening. If a bone is exposed, if there is bleeding, if there is respiratory distress, those are emergencies that you just don't want to, let's wait and see how it does till later. Again, probably broken bone is one of my more controversial stands. No one wants to have a broken bone, and if it's swinging around and flopping, yes, we would love to stabilize that. But no, I don't know the vet who would find a bone that was broken and within hours put it in a cast. That's not best for the pet. You need to let some of the natural swelling and decompression occur before fixation is achieved. And certainly you can call your doctor and they can give you some pain relief advice, or even some how to keep, ideally you just keep the animal as quiet as possible by really reducing the area where they can roam. Vomiting and diarrhea, very common with pets because they're rather indiscriminate sometimes as to what they get into. Certainly anything prolonged or profuse or causing a weakness that the animal just can't get up and walk because they're so weak from expelling all these fluids, that should be taken care of right away. But dogs are dogs. They will eat something and vomit. Cats will just vomit randomly. We just often never find the reason why. It might be just something they ate didn't agree that day, a little cleaning mechanism. Dogs that eat grass, often that induces some vomiting, and it's not necessarily dangerous. Again, think of when you're taught the principles of CPR, they want you to look at airway and breathing and at what the cardiac function is. So if you feel your animal is compromised with their ability to breathe, there's an airway problem or they're just gasping for breath, that is an emergency. Cardiac output, meaning if they look pale in the gums or they're bleeding outright, that's definitely reasons, and a sudden trauma, being hit by a car. Best to get an assessment. But my cat's been sick all week and now he's vomited twice. That certainly needs to be addressed, but it's not a 2 a.m. need to be seen call in my book.
So if someone actually, if a cat or dog vomits, they ate, an hour later, they're vomiting the food,
Right.
maybe not that big of a deal. Is there a
Right.
certain color or consistency? Is there something like if pure bile comes up,
Right.
or if it's certain, yellow or green comes up, is that something that you should be more
aware of? The most common things that dogs and cats bring up first is food. And backtracking a little, if we know they ate something that could be a poison, toxin, or a foreign body, that also constitutes a call or a trip to the vet. And if you're not sure, please call and ask, or again, contact the poison control line. They have an animal one. Should have been prepared. I can provide that for Todd for after the show. But usually food's the first thing that comes up because that, just like us, we might have been feeling quite fine, had a dinner, and then a few hours later, it's not feeling so good. And if the problem still remains, then they continue vomiting, and it's often just some fluid and foam, and it might eventually even turn yellow. That means we're sort of hitting empty in the stomach, and a little bit of the bile acids are bringing back up. Certainly, vomiting with blood or blood clots is a little bit more concerning. That's not as normal as we usually see for simple upsets, so I would definitely get on the phone after one episode of seeing blood. Same for when they're passing blood. It's a little bit more relaxing when blood is passing out the other end than when it's being vomited up, because there are some issues that need to be addressed, but again are not immediately life-threatening, meaning your pet will not expire in the next few hours or 12 or 24 hours when appropriate care is sought. But if they're vomiting up foreign objects, or if it still causes me chills, the words linear foreign body. In vet school, that means a cat or a dog has eaten something long like a string, and cats, of course, love to play with strings, yarn, the old adage of the kitten playing with yarn. Dental floss is a big problem because dogs will get into trash cans, and people often wheel out some pretty good lengths. The problem with anything that is a linear foreign body, and I've had this happen with a pup that ate a cassette tape, and the cassette tape does not have stretch and give and doesn't break apart.
Was this like in the 1970s?
Yes, that's how old I am. So these things go in, and they start winding their way through the intestines. You probably all from school remember what intestines look like, just this long, snaky trajectory through your system. And as they wind through, think of drapes on a cord or a rod. They start bunching up. That inside doesn't have give, that on the outside does. So they start bunching up over top. And unfortunately, because of normal peristalsis, which is the wave of motion that your gut is going through on a daily basis, it actually starts sawing over these objects and will actually lay open the gut, and it's often a fatal outcome. So anything that's long and string-like, dangerous. Believe it or not, pins pass. We've had many pins, needles.
Something that sharp will not,
even
will not
safety
puncture
pins open. I have
an
watched
intestine.
them. I have watched them go the whole way through, right out the back
Really?
end. You would not think that, yeah. And bra hides and bones. People have and pet toys. Certainly, anything that won't digest an acid, a rubber toy, is, if it goes down, it can act like a cork in the bottle, and that's a dangerous thing. Bones will digest. That stomach acid is very potent, and we don't like it if they swallow a huge bone, and it might cause stomach upset for quite a few days. But given enough time, it's better to let it digest and pass normally than to go through a huge exploratory surgery and remove something that will be broken down in time. What you want to remove is that which is not broken down. Raw hides outside of the fact it's cow skin, and some people don't like that idea, or the chemicals could be used when processed. So, little tidbit, if you buy rawhides, look for made in the USA, because they've gone through our USDA system, and these cows are bona fide certified for people to eat. So that means the skin is clean, not full of antibiotic residue too. Rawhides, you can see that when your pet starts chewing them, they soften. And even if they've somehow swallowed a piece whole, it would go soft very quickly in the intestine, in the stomach, and pass. The problem I run into is that pups or dogs will chew one part into submission, so it's all soft and floppy. Then the attached part's still nice, hard, and stiff, and they decide they're going to swallow that. So sometimes it will cause a little bit of a choking episode because this stiff part is in the throat and giving them some, and it can even lacerate and cause a little bleeding. When you see a little bit of bleeding after something like that has been swallowed, not fun, but it's expected and not overly alarming to me.
Okay.
But
now, what about bones? I know you and I
Yeah,
talked about this
yeah.
the other day. I know a lot of people say never bones, don't, or never a cooked bone. And what's your opinion on
Yeah.
actually feeding someone like going a raw
Right.
bone?
And again, this is my opinion, because I'm sure you'll hear different from any specialist, but the safe thing is no bones, therefore nothing's going to be a problem. But bones are a great source of calcium, and dogs do need to chew. And cooked bones are actually a little bit more brittle, and certainly we know that bird bones, by virtue of their hollowness, they're very lightweight
chicken.
because, exactly,
Okay.
they're a little more likely to fracture and splinter and cause some problem. So your mammalian bones are heavier set, and but one of my continuing education professors somewhere along my line had this great advice that any toy or any treat you give an animal should be parental guidance, rated PG, because things that look safe. Somebody's dog, and I know you probably have one, will find a way to make that unsafe. We have removed multiple, like ham bones, the ones that are sawed into about an inch thick and have the hollow center.
Okay.
Sometimes, based on the size of your dog, that fits beautifully right over the canine teeth and is worn like a ring. And we've had to get the bone saw out to cut the bone
Really?
in half to remove it from wedging over the canine teeth. Anything you swallow that is really hard and too large, just like in us, can be a choking hazard. And certainly rubber balls and toys are a little bit more scary. One of the more dangerous things animals like to eat might be our dirty laundry, because it has our scent on it. And again, look at
Maybe
the,
you have dirty laundry. Mine is always
You're always
clean.
clean,
Yeah,
all right.
so.
Use a hamper with a lid. But we do get a lot of reports of animals eating underwear, pantyhose, even sweaty shirts and socks. And again, that can become a linear foreign body in the system. But bones, I think, again, with parental guidance, watch what your dog does with them. One of the problems that's long-term for eating things like bones, we see some dogs are so aggressive with some of their toys too, not alone a bone, they actually start filing their teeth down so that the teeth don't even maintain normal structure for the life of the animal. And so if you look at your canine teeth on your dog and they don't come to somewhat of a point, be it tapered, they're more flat, you know your dog's working on something. And tennis balls are a huge
And
culprit.
that's not going back. Once they're gone,
They're gone.
They're gone.
It's like that enamel commercial for the toothpaste. And once your enamel's gone, it's gone. And what we run into is either a hard object that they're chewing on, they often will cause a slab fracture on the chewing teeth in the back, which can open up the pulp cavity, which means germs head in, the tooth is dead, and you'll have a problem and need a tooth removed, infection and abscess. Broken off canine teeth, same thing. And I mentioned the tennis balls. They're great toys, and if your dog is just chasing it and bringing it back, great. But if your dog likes to sit there and chew at it or rip the fuzz off the tennis ball, you have to realize that tennis ball is designed to hit a hard surface court going 100 miles an hour. It's tough.
Not when I serve.
It's like taking a scouring pad and using it on the teeth. So
Okay.
you have to be judicious. They're not bad, but watch how often they're working on it.
Okay. And I think the last thing you wanted to cover was fleas, ticks, and worms.
Yeah, well, they're all bad. We don't want our pets to have. I think one of the older ways of thinking, and again, I'm comparing how I used to see people treat pets in the 90s when I first started as a young vet, and what I see now. It used to sort of be, well, it was always harder to take care of fleas and ticks. We didn't have the same degree of product out there. And so it meant a shampoo and flea sprays and balms and powders, which all are very toxic. If you're spreading a powder along, that's a lot of chemical that's ideally you'd like to stay away from. But That being said, I really do feel it's a form of suffering to allow a pet to have fleas, because not even if you have a flea allergy, which is suffering ratcheted up to a huge degree, it's uncomfortable. If you've ever been bitten by a mosquito or a flea, and I know almost everybody's been bitten by mosquitoes, I've been bitten by fleas, it's much more intense, the itch. And when an animal's just crawling with these things, not only the creepy crawly feeling, but the bite and the reaction that ensues, and the reaction that you can have even from the flea poop that they leave on the skin, it is a form to me of cruelty. And there are so many good products, and I know people are worried about the toxicity. There's not a safe product. Just like when you have to take an antibiotic or medication, there will be repercussions. Nothing is 100% safe, but it's better than the alternative. And so talk with your veterinarian. Even the over-the-counter products, and there are many out there that are very good. There are many out there that are not. Discuss it with your vet. Say, listen, I want to buy this product at the local drugstore, but can you tell me, am I wrong in doing so? And if so, why, and what's my option? There are a lot of natural remedies out there online. I'm not an expert in that, but you might want to contact a veterinarian who practices more in homeopathy or natural remedies. They have a lot more insight and can tell you what's good and what's bad. There are things that are toxic, especially for cats. Like I mentioned before, they're a little more sensitive because they don't have the same enzyme systems that break down products that they're exposed to in the environment. And they're groomers. Something you put on a dog, your dog typically doesn't lick itself all over daily, and that's a cat's mission in life, is to keep itself clean. So we have to be a little bit more careful with our feline friends.
Okay. And last question, a couple of people knew that I was doing this today.
Yeah.
And there is a big controversy now between human vaccinations,
Right.
what we're putting in and what we're not putting in.
Yeah.
And you and I discussed this a little bit the other day.
Mm-hmm.
And I think you're probably going to be a little bit more middle of the road, but you can tell me in terms of, do you have an opinion on whether you should be using a vaccination that has all the adjuvants in it? Is that what it's called? Or ones that are a little bit more cleaner? I mean, what do you feel about that?
Yeah.
Or is that just a personal opinion?
Well, first of all, vaccines and frequency in animals is being reevaluated, because we all know about over-vaccination for pets as well as people. And an indoor dog who never goes out does not need a Lyme disease vaccine. That's an example of over-vaccination. That being said, even if your dog's out limitedly, we like a distemper vaccine, which covers a multitude of things. There's not just one ingredient in a distemper shot. So many of the things that are protective in those vaccines are left by other animals walking through your area where the dog goes out to do its business, be it your yard, even fenced-in yards. We have seen evidence of disease and or parasites when animals are only allowed in a fenced-in yard. So the owners have told me, no other animals come in the yard. Well, apparently something's coming in the yard, because these animals are picking things up from animals like fox and raccoon that spread it and leave it in the environment. And it's stuff you might not even see, but when your pet goes out, the first thing they're doing is using their nose to track and see who's been there, and therefore they're having contact with the mucous membrane. That's how you inoculate. So, and rabies is by law not only a good idea, it's a legal issue. You do want to have your pets protected with the rabies vaccine, because it is a fatal disease and it is transmissible to humans, let alone the legal ramifications. But in veterinary medicine, we do have vaccines that are, well, some of them they'll call PureVax or UltraVax. They are non-adjuvanted. And so an adjuvant basically means the vaccines aren't the problem. The actual thing that goes in to protect your immune system or to stimulate your immune system is not the cause of reactions and the ill feelings that some animals get. It's the thing that it floats in that helps make it a little bit more active or do its job. And adjuvant in the past has been things like thimerosal and aluminum-based compounds that we have now found can create some problems for not only humans but for the animals. And being that animals are smaller and tend to receive more vaccines in their lifetime than we do, to go non-adjuvanted is an option we have, and you can talk to your vet about what is out there. Not every vaccine line can be found in a non-adjuvanted form, but it is out there, and cats again are a little bit more sensitive to vaccines, we think. And I say that we think because the data now is showing we used to blame the vaccines for some of the cancers that cats would get at the injection site. But we find that any needle put in, even if it's we're just giving some fluids, saline, cats are so highly reactive that anytime you pierce the skin, you're stimulating the cat to have an immune reaction. So, but there are choices out there. The non-adjuvanted ones are more expensive, sometimes to a point of being prohibitive, but at least we have those options.
Okay. All right. Well, I think we've run over. I think Todd is probably like, kind of like this back there now. But just kind of wrap things up, is there anything that we didn't talk about, anything that you want to kind of get out there that, you want people to know about, your practice or just anything about animals that we haven't talked about?
Yeah, it's not a shame to not know everything about medicine for your pet, and the shame is not to call somebody who does know and can help you, because all of the veterinarians I know and have worked with, they know we all want the best for the pet. And sometimes it's stubbornness that doesn't let you call. Sometimes it's fear that you're going to be charged over the phone. Call and ask somebody. And if you do go online, try to go to a reputable site. Like, again, a teaching university has websites that often will tell you the facts about different animal diseases. Just put the question in the search bar and it comes right up. Just please ask, because the thing we feel most, the thing that tugs at my heart the most is when something could have been very simply and easily addressed had the owner known. And as pet owners, just like when raising children, it's your job to find these things out for them.
Okay. Well, this is my first time back in Beaumont, and I could not have asked for a better guest. You were fantastic.
Thank you
very, very much for doing this with me.
Sure.
And I think a lot of people got a tremendous amount of information.
Hope so.
Your information will be at the at the bottom, so I'm sure you're going to get it. Hopefully, several calls. But again, thank you very, very much for,
You're very welcome.
for coming on
My
this
pleasure.
morning. If you have any questions, anything that comes up, just feel free to give me a call. Like I said, people can give you a call.
That's
also.
right.
Okay. All right. Well, thank you.
Thanks.
All right.